Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. March is National Social Work Month, a time to recognize the dedication and empathy social workers across the country deliver while providing services to children and adults in need. Social workers are advocates, advisors, counselors, and facilitators in schools, hospitals, businesses, and government offices. They take on many roles and are always in demand. Social work is a very broad topic. So today we're focusing on the clinical and behavioral medicine side of social work. We're discussing all that with Phil West, a licensed social worker and lead clinical therapist of behavioral medicine and psychiatry at the WVU Rockefeller Neuroscience Institute. Welcome, Phil, to Tuesday Talks.
Thank you for having me.
I'm glad to have you here. Okay, so this is a very broad topic, but I feel like social workers have touched everybody at some point in their life. Like, recently my mom was released from the hospital and we worked with a social worker on her discharge plan and an aftercare plan, and they helped us find, transportation and things like that. I mean, really, social workers touch everybody at some point in their life, don't you think?
At some point, yeah. Just similar to you and your mom, when my wife and I were in the hospital after she had our kids, it was social workers through care management coming in and talking to us about postpartum depression and making sure we had all the resources available to us that we would need throughout that process.
So there's a lot of different roles. You wear a lot of different hats. You can be a lot of different kind of social workers. But it sounds like, social workers can be counselors, advocates, facilitators, but it's basically just helping people in need.
Yeah, we do help a lot of folks in multiple areas throughout our careers. Whether you're doing clinical therapy like what I do, we're still advocating for our patients to get them seen, to get them into treatment, maybe with a psychiatrist, or helping them navigate legal resources that they might need. Getting them, some folks don't even really know how to establish with a primary care physician. So we're teaching them how to make those phone calls and what number to call. So we do impact lots of folks in lots of different ways.
And social workers are highly trained, right?
To be a clinical therapist and to work in care management through the health system, we do have to have a master's degree in social work. So that's 6 years of schooling to do clinical therapy.
Wow.
It requires 3,000 clinical hours and then 100 hours of clinical supervision, plus another licensing exam that we take.
That sounds like highly trained.
we do have quite a bit of training, yeah.
Wow. Now, since it is Social Work Awareness Month, I feel like we should give a shout out to all the social workers in the different roles in our health system. And I know you don't want to leave anybody out, but can you just give me a general idea of the different departments and roles and different kinds of social workers that are working in our health system?
Yeah, so we have care management throughout all the departments within the system. Pediatrics, different units there, HVI tower, the main tower. We have, and then including the emergency department, the transplant team. We also have faculty social workers who will help teach our residents about doing therapy and our approach on things. We have researchers. A lot of our faculty social workers have done a tremendous amount of research.
Really?
We have clinical therapists, and then we have bachelor's level positions for care management, or case management, where they will help with our medication-assisted treatment programs. They help with a lot of our specialized clinics that we have.
Wow. So, there's a lot of different fields, different options to go into. So what drew you to the social work field?
It's kind of twofold. My father's a licensed independent clinical social worker too. He got his MSW when I was in middle school.
That's a master's in social work.
Master's in social work. So watching him throughout his life. And then he talked to me at one point when I was trying to figure out what it was that I was going to do. And he told me I should go do social work, and I said, that's silly. So I went and studied music and realized I was not going to be good enough to ever make it as a musician. So I heeded his advice and went to social work. But one of the other pieces of that is serving in the military and seeing some of my friends come home from combat deployments a little bit different than when they left.
Oh, yeah.
Wanting to learn more about that, wanting to kind of learn how to help folks who have experienced trauma.
Yeah, yeah. So, yeah, because you are a clinical therapist. So let's talk about your focus for a little bit here, the clinical and behavioral medicine side of social work. What role does social work play in your work as a therapist?
It's person and environment. So we really try to look at, how the person is interacting, what's going on with them through biopsychosocial models. We'll even use the spiritual model as well in some cases. A lot of folks will use their faith to help them through very difficult times. We want to figure out what's going on biologically. Do we need to get primary care involved? Do we need to get psychiatry involved? What's going on socially in their life? Is it stress with COVID? Is it stress with finances? And so we really want to try and help navigate through those stressful times in their life. Sometimes, too, it's issues from their past, maybe how they were raised, childhood traumas, ongoing anxiety, depression. So we really want to try and help folks navigate through those emotions that they feel. Might not know how to feel them.
Yeah.
So it's a lot of emotional regulation techniques that we teach and help our patients learn how to process their emotions that maybe they feel stuck in. And then we have our social justice piece of things. So clients are the experts, and I do not pretend like I know everything about everyone's different culture.
Right.
And so I ask my clients to teach me about their culture.
Okay.
So then I can start putting myself a little bit in their shoes so I can help them, they can help me learn. So it's a team effort in the room.
Have you seen an increase in need, not only through the pandemic? I know we're not totally done, but we're coming out the other side here. I imagine that has just increased the demand for therapists and social workers and just mental health needs.
I think the pandemic has brought a lot of that out through isolation.
Yeah.
Increased fear, especially at the onset of the pandemic and then with the different variants as they come out. So there has been an increase in need, which is a blessing in disguise. People are finally able to talk about mental health. They're open to talking about mental health. And luckily we work for a system that's supportive of staff and employees seeking mental health treatment.
So as a therapist, you're not just working with the patients, but there's some work with the families around them, isn't there?
Correct. So we do have some therapists who specialize in family therapy. But either way, that patient is involved directly with their family.
Yeah.
So we're still teaching, we're still working through the family dynamics, navigating family stressors. Yeah.
I always say every family has their own flavor of dysfunction, right? And everybody's got something.
Everybody has something.
Or am I just saying that to make me feel better, right? Everybody's got something. You also specialize in crisis management. Now, that's got to be an extremely challenging part of your social work role.
So I started working for the crisis suicide helpline during graduate school. That was my first kind of taste of social work life. And so we were helping folks who were in crisis for different reasons. And one night we would have somebody call in who was in crisis for what society would probably say was a socially acceptable reason. Maybe it was intoxication or a death in the family or loss of a friend. And then we'd have other folks who would call in complete panic over not being able to find their car keys. But what prompted the call was the car keys, but what we would really find out is that there were significant other issues in their life. But it was nice because it was one of those situations, one of those resources available for folks to just be able to call and talk to somebody that wasn't going to judge them, wasn't going to be a harsh voice on the other end of the line.
Right.
And then with the suicide portion of the line, when folks would call in for that, it might be getting them set up with resources, helping them get to the emergency department. It might be families calling in and saying that their loved one is currently expressing suicidal ideations with a plan, and so we would help them navigate the mental hygiene process, and then get that hearing set up for them. So it definitely had its challenges from time to time.
Yeah, and a lot of times they just need an understanding voice.
Mm-hmm.
Yeah.
Just empathy on the other end of the line.
Wow. I can imagine that could be stressful for the therapists too, right?
Yeah, and luckily it was a team, just like we have now. Even though a lot of the work that we do as clinical therapists is independent, we still have a team of folks. We have clinical supervisors, we have administrators that are willing to help us and listen to us, and address some of those concerns that we might have, or transference, countertransference that we might be experiencing as well.
Wow. So another big part of working in social work is advocating and connecting people with the resources when they're in need. I mean, because a lot of people don't even realize what kind of help is out there, or where to even start.
Right, and Google is my friend.
Yeah.
Because it's impossible to know all of the resources, and so just helping somebody navigate through a legitimate resource versus something that maybe is not so much.
Yeah.
But it's also, I don't work with children directly, but I have a lot of colleagues that do. And so if one of my patients is a parent and they're talking to me about issues with maybe their child, I can message one of my colleagues and say, what resources do we have available? So we do rely on each other for all of our knowledge base.
Teamwork.
Gotta love it.
Yeah. Yeah. Now, I know you don't get rich being a social worker, but, and I read an article where more than half the people surveyed said that social workers should be paid more. I don't know who wouldn't agree with that, but, I mean, this sounds like a job that really, it's a calling, isn't it?
Yeah, and I think our clients can tell. When they're sitting across from us, they can see that we have the empathy, that we have the compassion to be there. Like, we're not there to make millions of dollars in a year, but we don't do it for the money. We do it for just to be willing to help folks through difficult times in their life, to be able to be there for people. There's no greater joy.
It's rewarding for
Very.
you, isn't it?
Very.
Wow, that's great. Thank goodness we have people like you. Seriously, we need that. So before we go, I always like to ask, for the people that are watching, our viewers, what's the most important thing you want our viewers to know about social work awareness?
It's a really great question. I would say it depends on who the listener is. If it's a physician or somebody who's working for the institution, I would say listen to us, ask questions. Let us be that resource for you. Care management, they're very great at having the knowledge base about mental health for their patients and being willing to help with the patients. If it's a potential client or somebody who's just interested in wanting to know more, reach out to us. Let us help. There's no such thing as a silly question. I might give a silly answer from time to time, just for fun. But really, we want to be there to help folks. We want to be able to answer those questions and help folks navigate through difficult times in their life.
Okay, great. Well, thank you so much for sharing all this good information. Happy Social Work Awareness Month, and thank you for making us more aware of, all the hard and much needed work that you do for all of us. Thank you.
Thank you for having me.
Okay, great. Well, that brings us to the end of this edition of Tuesday Talks. Join us on Tuesday Talks on March 21st when we'll talk about multiple sclerosis and its treatments with neurologist Dr. Eric Sechrist of the WVU Rockefeller Neuroscience Institute. I'm Mary Ravazio Menard, and on behalf of Phil West and everyone at WVU Medicine, thanks for joining us and have a great day.